Conference will now be recorded.
Thank you, random lady. All right, so croup. So this is that seal like, yep. Laryngotracheobronchitis. Big word. Croup.
I like that.
Me too. It's a lot easier to remember. So your national registry questions, or even questions that you'll get in this class, it's always a child has parents called for shortness of breath. They have a seal-like barking cough. Then in your brain, you're like croup. So that's usually how that question is presented.
I feel so bad.
Yeah, it sounds really crappy. It sounds horrible. The biggest thing in treatment is, so the symptoms are often worse at night. Biggest thing with treatment for like what you can do on an ambulance, blow by oxygen, but try and keep the kiddo calm. So like 6 months, they're usually like, where's my mom, right? So try and keep them calm, because the more worked up that they get, the worse that cough is going to be.
That's when you just take mom with you too.
Oh yeah, mom comes with me. But remember, like if we're transporting mom and baby, you're not supposed to have mom carry the baby, which can be kind of a pain because the kid's like wants their mom. But still, we want to keep them both in their own seatbelts.
And you said blow by oxygen. Is that the one where you just kind of hold the mask in front of their face? I think.
Yeah, I usually have mom hold it there. Yeah, but yeah, just keep like non-rebreather, turn it on 15, and just hold it by their face.
You can take sometimes you can take it like the nasal cannulas and like clip the end off one and wrap it around the ear and tape it to the side of their face. Turn it up like that. There's a couple of different methods you can kind of work around.
I've seen where they take like a nasal cannula, cut it, put it through the bottom of like a cup, and then same kind of idea as a non-rebreather, but it's just more
Direct.
Yeah. I was gonna say more
Like,
concentrated.
yeah,
It's this. I hope y'all can figure out my hand gestures.
We're getting there.
Symptoms often worse at night. This is the one where parents like to, like if it's cold outside, usually this happens like right as it's getting cold. They'll roll down a window, keep cold air on baby's face. It helps because cold helps with inflammation. So that cold air will help keep all of this kind of less inflamed. So transmission by droplets, it survives on objects, so you need to make sure that you're cleaning everything really well. Again, with every patient, you clean down the stretcher. Avoid touching your face, and then you're gonna treat the symptoms. That's basically your golden ticket to passing any kind of EMS test. In the real world, it also applies. So if you don't know what's going on, they could have some weird, crazy disease or like something going on. As long as you are treating the signs and symptoms, that'll get you through everything that you're doing in real life and on a test. So if they have shortness of breath, do you need to walk in and be like, I know you have croup? You're still going to treat shortness of breath, whether you know that they have it or not. So that's your golden ticket. It took me all the way to paramedic school to realize that, because I'm like, I have to memorize all of these treatment modalities for every little thing, and then I'm like, just treat the signs and symptoms. Seems so simple, but I don't know why my brain couldn't comprehend. Okay, this is, I believe it's whooping cough, or it might be the croup. Why is it so quiet? Where's my remote? Did everyone get a chance to hear that? I did. It is. Yep. So whooping cough, it's called pertussis. So this is caused by this Bordetella pertussis. So the portobello mushrooms cause a whooping cough. So they call it whooping cough because they say whoop while they're coughing. They're like, whoop, and then they cough, whoop. So this can happen in not only kids, but it happens in adults as well. Also very scary to see. I've only ever had one patient with it. Usually if they're vaccinated, you don't have to worry about it so much, like somebody getting it. But again, there's always those one-offs where the titers are low or, somebody just wasn't vaccinated. So those coughing fits, like the guy that I had that had this, he was older and he was like coughing, and like I had the pulse ox on his finger and I watched it just drop the whole time. He's like trying to catch his breath and he turned like bright red. It was scary. So treat the signs and symptoms again. Such a big sigh. Such a big sigh. Cookie likes to do that. She'll be laying on the couch all night. She's just like, wow.
She did not like it when you left.
No.
No.
I walked in, she was all curled up on the couch.
She wanted nothing to do with any of us. So. And then you got here and then she was like,
All right, so it is spread by large droplets in the air. So usually your masks can protect you pretty well because the masks filter larger droplets. They treat it with antibiotics, and then there is that Tdap vaccine that everybody gets when they're, or most people get when they're a kiddo. So that prevents that's the P part of Tdap. A pneumonia.
Pneumonia.
Your little chest x-ray. So you guys don't have to know all this stuff, but you can see it on chest x-rays. You get like these white blotches. So you see how like from here down is like a lighter color white. So depending on where it's affected, you can see it. If you let it get bad enough, I just learned this the other day. It causes like abscesses in your lungs if you're not treating it. It can cause big old pockets of pus to hang out in your lungs. So something that if
It sucks.
the pneumonia, oh yeah.
I've had it.
Have you?
I
I've
was
heard
in the
that it's
hospital
rough.
for 3 months.
Yeah. Luckily I've never had it, but I've heard that it's absolutely horrible. Like it hurts. You can't take a deep breath in. So pneumonia. So fever, chill, shortness of breath. What is tachypnea? Rapid breathing, and then a productive cough. So yeah, it is transmitted by droplets. So productive cough, what is that? What is that? Yeah,
it's a nasty smell.
yeah. And usually with pneumonia, it's like this really icky color. So a lot of times it'll be like a green or yellow. Sometimes it'll start out like a kind of a white color, but like as the infection gets worse. So if someone has a cough, I always ask them like, how long have you had that cough? Or is it productive? Because that can tell you a lot. Like if they're coughing up pink, that's a different story than if they're coughing up green. So pneumonia, big cause of sepsis in older folks. Anybody that has a very sedentary lifestyle or they don't move around a lot, they're just chilling, pneumonia can be a big thing. Another like group of people that's really susceptible to pneumonia is somebody that's had recently broken ribs. So if you're not taking like full intended breaths, you're like taking shallow breaths because it hurts to take a deep breath, that mucus can build up because you're not clearing it out with your respirations. It can cause pneumonia as well.
Is that why when you get broken ribs that they give you that thing to try and breathe in and try and get it up? I don't know what it's called.
Yeah, I can't remember what it's called. The ball.
Yeah, it's just supposed to help you like keep those muscles moving for that reason.
Because once you stop using those muscles, remember those alveoli can collapse. Does anyone remember what that's called? It's a big word. It's called atelectasis. So atelectasis, pneumonia, they're hand in hand. Could cause febrile seizures in young children. Can cause altered mental status. Just think all of your criteria for sepsis, pneumonia. So altered mental status, low oxygen saturations, high fever, high heart rate, low blood pressure. So any two of those things, altered mental status. If they come out of a nursing home, if they live a sedentary lifestyle, you get somebody that drives truck and doesn't like move around a lot during the day, doesn't like walk.
Why are you looking at me, bro? I get out all the time.
Consider sepsis. So there also is a vaccine for pneumonia, usually for older folks. They really push it. So spread by droplets, but close contact over several days. A lot of times if you're like walking through a hospital, you'll see some like, they call it like infectious control signs on doors. And a lot of times that's because that patient has pneumonia. So usually if you have a patient that's admitted with pneumonia, every time you talk to them, touch them, do anything in their room, you have to put on a mask. Usually an N95. So they just want to prevent you from getting it because it sucks so bad. So there's different types of pneumonia. You can get a fungal pneumonia, you can get a bacterial pneumonia, a viral pneumonia. So it's just important to prevent it because obviously pre-hospitally, we don't know what kind of pneumonia that they have. So most of the time the treatment is with antibiotics. Most of them are like a bacterial pneumonia. So if they're treating with antibiotics and it's just not going away, that's usually when they start like doing other things. They'll go down and do like a bronchoscope and see what's causing it or what's doing it. Because like if you have, like say I accidentally inhaled a piece of broccoli while I was eating it and it got stuck in my lung, it can cause a pneumonia. It's an aspiration pneumonia. Well, if I didn't know it was stuck in there and the doctor didn't know it was stuck in there and it just keeps causing a pneumonia, they'll go in and scope you and make sure that everything's looking okay.
Your hat.
Most of the time, they will put lidocaine up your nose, and usually they go in your nose, and it's just a big long scope, and they go down into your lungs.
It's all just in there currently.
Yeah, like I seen a video of someone that was intubating because you can record on the video things, and what was it, a worm? It was some kind of slug or something in their freaking airway. It was like, ooh, what would you do if you seen that? I'd be like, I'm done. Yeah, gross. Yeah. All right, so tuberculosis, night sweats, weight loss, fever, cough. Usually it's dry, but later it produces a purulent sputum. So this is what they're talking about, this color right here. Less, it's like that icky color. Again, pneumonia can have the same kind of color when they cough it up. So the test question for tuberculosis, your big like flashing signs are going to be somebody that lives like in a condensed community, whether it's like a homeless camp or like a fraternity, sorority house. Those are big factors for tuberculosis. Nursing homes. And then they'll usually toss the night sweats in there. So if you have a question that's like a homeless man calls, he's in an encampment, he's been having night sweats and a cough, your brain should be like tuberculosis. That's always the answer.
Dumb question. Tuberculosis doesn't go away. Right? Like
They-
maybe like HIV or.
No, they can treat it.
Oh, they can.
Yeah, it causes like, it looks like blisters in your lungs, but it is treatable. Back in the day, it was not. So back in the day, like they used to say, move to a dry climate, good luck. And then now that there's treatment.
Oh,
Once you
Doc
test
Holliday.
for it, though, it's kind of like in your body forever, right? It's just absorbed it.
Yeah, so TB like testing is an interesting thing because like if you get too many TB tests in like a short amount of time, you'll start testing positive for it because you keep getting the same test and it can cause a positive. So once you get that, they'll do chest x-rays and stuff to make sure that you don't have any active. But once you've had tuberculosis, I believe that you will continue to test positive for it. So if you ever test positive for a tuberculosis test, don't freak out. They'll take you in for a chest x-ray. So that's just their indicator like, hey, we need to do a chest x-ray most of the time, unless you've been around tuberculosis patients, you won't have it. But remember, there's a lot of false positives on that little skin test. So if you have a patient that you're suspecting has it, put on your N95s. I've had one TB contact, didn't know the lady had TB, wasn't even suspecting it. She came out of a nursing home, and I found out 11 months later that she had it. I got a call and was like, hey, this lady had tuberculosis, so I had to go through all the things. And then, what are those people? Workers' comp called me, because it was all under workers' comp. They're like, have you been around cows in the last decade? I'm like, I live in Idaho. Of course I've been around cows in the last decade. And she's like, what are you going to do now that you have tuberculosis? And I was like, I have tuberculosis? Like, what? So very silly, but I didn't have tuberculosis.
Don't go with that.
So you just like,
Yeah.
yeah, go in for a test.
Yep, they did a
You didn't
TB
have
test.
it.
Okay.
Yep, they did a TB test. Mine was negative. And then filled out some paperwork that was like, yeah, I was exposed this day. This is, you know, I didn't have to do like the chain of everybody that I've came in contact with in the last 11 months. They didn't make me do that. So
That would really suck.
that would really suck. I'm like, literally everybody. It's been 11 months. Everybody at work, everybody at home. So treatment is with antibiotics. Now that our medicine has kind
Progressed.
of evolved, we don't have to just move to a dry climate and die sweaty in a bed with no AC. Like old Doc Holliday, R.I.P. All right, meningitis. This one is a little spooky. So you can have, you can also have fungal meningitis, bacterial. So usually it's caused by this bacterial. So signs and symptoms: abrupt onset of a fever, nausea, vomiting, severe headache, like headache that just won't go away. So meningitis, if we break down the word, right? So meninges is what? Brain. Our brain and spinal cord. So inflammation of that. So usually they test to like fully get the full test of it, they have to do a spinal tap. So they come into your brain, they come into your spine. They're like, they go into your spine, they pull fluid out of your spine, which that procedure in itself causes a horrible headache anyway. They can cause something called a CSF leak, so cerebral spinal fluid. And then they test you for it. If you're in contact with somebody that has had meningitis, it seems very scary because you're like, oh no, my brain's gonna get infected. They literally hand you a single pill and they're like, take this, you're good. So the prevention of it is like one like antibiotic pill. What is nuchal rigidity?
Is it like, does it have something to do with cells?
So it is like extreme pain in your neck. Your neck gets like super stiff. Close. I like that.
Or something.
The nucleus, I like it. Try to break it down. So nuchal rigidity is very bad, like neck stiffness. So if someone has meningitis, like kiddos, especially if you go to move their head around, it hurts. They'll start screaming. In little kids, you can take their head, you can do a test for this. If you take their head and just move it up like this, their knees will come up because any kind of flexion of their neck causes like pain down their whole spine. So if you move their head up, they like do this number and you're like, okay, I can't remember what it's called. It's like Rudinsky sign or some weird shit. So neck pain, they're like, my head hurts and I can't move my neck. There's a fever. And then they get this rash. So that's the petechiae. That's what this word means. It's like this red, splotchy little rash looking thing. So what you can do to test for like a meningitis rash is they call it non-blanching. So what you can do is you take like a clear glass cup and you push down on the rash and look through the cup. And whenever you push down on a regular rash, those red spots will go away. But when it's meningitis and you push down, those red spots stay while you're pushing down. So they call it blanching or non-blanching rash. What is photophobia?
Photos.
So, I have photophobia all the time.
Me too.
Yeah, so it's not so much fear of lights, but it is pain. Like when you look at a light, if anyone in here's ever had like a migraine where like the light hurts you, that's photophobia. So, big thing is like watching that. Don't bank on the petechiae being there. So that's always taught. But a lot of times they call it the big three. So it's fever, neck stiffness, and a rash. Most of the time they don't even have a rash. I think Calvin said it's only present in like 30% cases or something. Calvin's got all the numbers stored in his brain somewhere. I do not. So yeah, meningitis can be kind of scary. Don't believe so. I think it has to be like treated because it's an infection in your brain. So this is what it looks like though. So here's a healthy brain on the left. And then here's meningitis on the right. So that green yucky, that's what it looks like. Just that sign of infection.
So to test for that, we would just cut their skull open.
Yeah, basically.
Mhm.
I usually forget my bone saw
Yeah.
at home.
So I have a
Unfortunately.
little pocket knife. I keep it.
What's that?
Start chipping away.
Jeffrey Dahmer thing?
Oh yeah, he drills into it.
Drill a hole in it.
Yeah.
Yeah, we have
Actually-
IO drills. They use the IO drills that we use. They use them in the hospital to create burr holes. They drill them in somebody's head, to relieve pressure. So we could do it.
We could, but I feel like we would need Calvin there because you need to localize where that bleed is, and that's where you have to drill.
Yeah, but I'm talking about for the meningitis thing, right? Like that's a global brain thing. So you just drill a hole in there and see if you get pus.
Yeah, sure.
I like it.
Get in there, there's just 4 holes in their head.
Yeah.
Find it. Let's try to find it.
I tasted this. It tasted like infection. Yuck.
We'll talk to Mike about it.
Yeah. We'll see what we can do.
Do you want a sample?
All right, so STIs, STDs, so the gun herpes syphilis, so HIVs and STD, Hep A, B, and C fall in that category. Genital herpes also falls under, and then HPV. So all of these are viral. So these are ones that you get and they don't go away. You have them, they're yours now.
Is there a vaccine for meningitis?
Yes. So then you have bacterial STIs. So these are the ones that can't be treated and they go away with any kind of antibiotic. So the clap, gonorrhea, syphilis, all that jazz. Syphilis, if left untreated, can go to your brain. So that's another thing that big NRS thing that they gave the hospitals that you have to do this. Anybody that hasn't done prenatal care, they have to test for syphilis. So it can be transmitted to the baby and it can go to the baby's brain, cause a lot of problems. I had a guy in Atlanta, we were like, he was sick or whatever, chest pain. And I'm like, okay, any history? He's like, no, I have no history. Get him into the ER and they pull up his history page. He went into cardiac arrest. He had been in cardiac arrest, heart stop, because of syphilis. Like it had just spread so bad that it killed him. But he came back. He was alive. I was like, hey, buddy, that's kind of pertinent information when I give you a history. Like, yeah, I've been dead before. Like, that's kind of important, but whatever.
We did before because the syphilis.
Yeah. Yeah. So, we seen the herpes all the time in Atlanta. Ladies love to whip their clam chowder out at Chaz and show them their herpes.
Dude, what is this?
Yes.
Oh, gross.
He said, that's herpes.
You have a problem.
Yeah,
This happened multiple times.
multiple times.
So that's like my dad and lesbians. For some reason, lesbians love
Oh yeah, they love her too. In all fairness, she wears flannels and drives a Subaru. So
Yeah. My favorite story, the herpes story. So this was right after COVID, and then monkeypox, right? You guys remember the big monkeypox scare?
Oh, yeah.
Well, being in Atlanta, the headquarters for CDC is in Atlanta. So whenever there's any kind of anything like COVID, monkeypox, Ebola, anything crazy, it just goes nuts, right? So Atlanta's airport's huge. Usually they're dealing with like patient number 1 or 2, like they always get all that stuff. So monkeypox, big deal. Every time we suspected it, we had to call an alert to the hospital before we brought the patient there. And then like monkeypox, the thing that causes it, I can't remember if it's viral. I don't remember. Whatever causes it lives on surfaces for a really, really long time. So like our ambulance would have to go out of service. We'd have to like disinfect, let it sit for a while. So anyways, we get called for red eyes. This lady called because her eyes were red. And she lived in quite the little complex on Fulton Industrial Boulevard, which is like prostitutes walking down the road. There's strip clubs, there's sex clubs, like FIB's gross. So anyways, she calls, she's got red eyes, we get her in the ambulance, and I'm like going through the questions, and I'm like, okay, any suspicion of like, are you suspicious of monkeypox? And she's like, yeah, I got a weird rash. And I'm like, okay, well, he's on the phone giving a report over a recorded line outside of the ambulance. So before I asked any further questions, I just opened the door and was like, hey, this lady thinks she has monkeypox, just so you can let the hospital know. And I shut the door, and I'm like sitting there asking her questions. So he flings open the back door. I'm sitting in there with her. He flings open the back door, and he's still on the phone. He goes, you got monkeypox? And she just looks at him and like whips her cooter out. She's like, and he goes, on the recorded line, he goes, that's herpes. That's herpes. So anyways, we'll be there in 10 minutes.
I had one of them propose to me.
He did.
Yeah, freaking me and my dad ran, same thing. Me and my dad were working on a truck together. Lady called for a freaking vaginal itch, and we got out there, and he had herpes. She was like, what am I supposed to do? I was like, nothing. I was like, you can go get a pill. It'll be gone in a couple of days. Like, there's nothing to do. And freaking like 2 weeks later, she saw me sitting in the ambulance, so she like walked up. She was like, next time I see you, I have something for you. I was like, that's okay. And she's like, no. She just walks away, and I was like, all right, well, I don't have to worry about that again. My last day working on an ambulance in the city of Atlanta, I was sitting in a parking lot in an ambulance, and I seen her freaking walking across the parking lot, and I was like, this freaking chick. And she like walks up, and she's like standing at the window, and I was like looking at her through the window. She's like, roll the window down. Come on. Then I like rolled the window down. She was like, put your hand out. And I was like, mm-mm. And she was like, come on. And I was like, mm-mm. And she was like, I'm not gonna hurt you. And I like put my hand down. She flipped it over, stuck a ring on my hand, just walked away. And I was like, I think I just got proposed to. I don't really know how to feel about this. And sure enough, it was like this giant freaking behemoth of a gumball ring. So I felt honored. I got proposed on my last day working in Atlanta.
He sent me a picture of it because I was at home. He's like holding it with his gloved hand, like, I think this is how it just proposed to me. All right, so STI, STD prevention and treatment. So condoms, obviously protection is a big one, not just birth control. You need no condoms. I don't have to have that talk with y'all. When I taught high schoolers, I had to have that talk about this slide with them. Listen, y'all. So these STIs can lead to pelvic inflammatory disease. So it's called PID. It's where it spreads up into like higher up into their like uterus. So usually this is caused by gonorrhea or chlamydia, but it's severe abdominal pain. But the big thing that you'll see, I call it the PID shuffle. So there's a very specific walk that these folks get whenever they have pelvic inflammatory disease. It's the PID shuffle. Increased vaginal discharge. Usually it's smelly. It's like associated with really smelly discharge. Smells like more like a fish, and is usually what you'll hear. But all of this is infected and it's starting to like drain out. So if it's not treated, this is what happens. So it needs to get treated. Again, not a lot of people call 911 for like STDs, STIs, but it happens. Like we were just
Sure,
saying.
Atlanta.
Here in Atlanta, it happens all the time. Is anyone still taking notes? Sorry.
Good.
All right, so ticks, Lyme disease. So Lyme disease is pretty scary if you think about it. It can cause a lot of problems. They don't go into as much detail in your guys' books, but it can cause like really bad heart problems, like bradycardia can be caused by Lyme disease. So usually you get this very distinctive bullseye rash with and at the tick bite is where this like Lyme disease, what it looks like. Usually people that get Lyme disease, they could be outdoorsy people or they could not. Big thing is prevention in the outdoors. So ticks here, I know we have them. So yeah,
Yes.
yeah, especially up like in the trees and stuff.
South Fork have no outside view.
Deer are a big carrier of ticks. They love to sit on their faces.
Excited to live here. Stuff really mosquitoes or like fleas and bed bugs. And
You got mine.
like I came from Washington and there's a lot of bloodsuckers.
She really
And I react really bad to anything that sucks my blood.
You need to get south of the Mason-Dixon line.
Oh,
You want to see, you want to see some bloodsuckers. Everything down there bite.
Them mosquitoes, German Shepherd.
I mean, it's stand there flat.
You're like,
No stop it.
July.
Give me your phone. Mosquitoes, just like where I grew up.
10 minutes. I got
Northern California, they're so big, they just, you know, flat.
So obviously, as you all know about ticks, it's not something that you notice right away. If anyone's ever had a tick on them, like you don't feel it bite you. So it's something like you look at later and you're like, oh, there's a tick in my armpit or wherever it is. They like to hang out on the hairline. So prevention, DEET, DEET sprays, whatever they call it, mosquito spray. The DEET will keep ticks away from you. All right, so newly recognized, I believe this was pre-COVID. So emerging, newly recognized. So antibiotics that used to be effective can no longer work. So that's a big thing. They're trying to push not giving antibiotics as much because even it still goes on today. But you walk in with a cough and they're like, here's an antibiotic. I have a swollen toe, here's an antibiotic. They threw antibiotics at everything. But here's the thing about bacteria is it is resistant and it evolves. So wimpy little bacteria, as you're taking your antibiotics like you're supposed to, you start feeling better. So you're like, hey, I don't need antibiotics anymore. Well, all the wimpy bacteria is dead. But now the tough bacteria that was resistant to those first few days of antibiotics is now multiplying. So this is why it's important that you take your antibiotics all the way to the end. My mom is the worst at this. She's like, I still have a half a bottle of antibiotics from 2 years ago. And I'm like, I'm supposed to take all of it. Because that bacteria can evolve. And then once it evolves, if that one starts multiplying, you get really, really like resistant bacteria. So this is where this like antibiotic resistant bacteria starts to come into play.
MRSA? Huh? Is that MRSA?
Mm-hmm. Yep. So methicillin resistant antibacteria or anti something.
What is the Zika virus? If that's even how it's pronounced.
That's like it was like an African virus, huh? Yeah, it's
That
like,
sounds right.
yeah, it was like coming out of Africa.
I know Ebola is the one that makes you bleed from your eyeballs.
So Zika virus is a mosquito borne illness. It can lead to a lot of birth defects. So if a pregnant person's infected with it, you get it a lot in those like tropical areas down in like Africa and stuff like that.
Yeah. So, yeah. And then COVID, obviously. So COVID, everybody used to be like really scared of, now they're like, oh, treat it like the flu.
Am I saving it?
No,
Don't say it.
I guess not. All right, if anyone needs to go to the bathroom, feel free to take a quick
So,
5-minute break.
this one? Now?
Yeah.
Hmm?
But you know what, they probably should have done a lot more than one that is on here.
Oh, yeah.
Because there's 84 slides on this one, how many's on there?
30.
Okay.
Yeah, there's a lot of nonsense on those ones, and they're boring. They're like nothing,
Yeah.
just words.
Yeah, it's just, there's no pictures, there's no, yeah, this one was really kind of.
Yeah, because every single EMT class that I've ever like been a part of, taught, like not been like the designated instructor for, I always am told, or like I've heard them tell the students, I almost said patients, that they're like, this isn't gonna be death by PowerPoint. And then they pull up those things, I'm like, okay.
It was hard to stay away from this one.
Yeah, yeah.
Everything's always said. When it wasn't that.
Oh.
Why are you going backwards? Don't go backwards.
I'm giving them the beans right now, baby. Freaking Billy's getting it right now.
Uh-oh.
An Asian player? It's like an apple, but it's like pear. What's going on, Billy? What's going on, Billy?
Oh, I don't even know. All I heard was Billy's getting it right now.
Is he on a call?
I don't know. I have no idea. You have as much information as I have.
He's other. What's other Billy? That's PJ.
There's lots of Billies around here.
And that's great. I found that out today. That's great. You didn't know that? That's why everybody gets nicknames. I don't know. I know you're late.
Y'all got the next
I'm not forgetting ours.
Mariana.
Mine's out where it's in space. Yes. What's the other one's name?
Mariana.
Mariana.
Marissa.
What is it? No, what's it?
What are you looking at your name?
And I keep,
Look at where it is.
I know he's, I always try to call Kevin.
Yeah, man. I've not responded to
So it constricts your vessels,
Exactly.
but then it dilates
No, I want to
your
tell
arms.
you.
Oh, your nickname?
Or
I
maybe.
had it, and then I changed my answer.
Rest of the patients up in a.
Because I was
No, I'm.
really in my head when I was studying.
So it does do both.
UFC.
Obviously, you're studying.
It does all of these.
I'm always.
Oh, yeah, I don't know what
Maybe
that
it goes
is.
I feel like I'm in the.
Oh,
but
you don't either.
I'm not.
I know it's State Farm.
I'm
Not sure what Steve wants to do. Nugget.
Bronchodilation, vasoconstriction. It is a non-specific alpha and beta.
And then also I got family where it's like adding doses,
Oh, yeah, so the epi injectors are just one use. Whenever you like cut them open and use the other stuff in there, that's not.
That's the call.
You know, you could do that, but
there is more in there,
I
but
think in
I
gold.
don't
Sorry, Malaki.
yeah, so usually like when you get or prescribed an EpiPen, they'll have like 2 of them, a pack of 2 that you pick up at the pharmacy for that reason, because you might have to use more than 1 dose. So.
and on the question on here, I got it right, but it was like,
Yeah.
negotiation.
A lot of them are like, no, no.
Just give it to her, like, for stretcher, and
I can't remember his real name.
Since it's okay for us to give it, do we have to call medical?
So it per like national registry practice. you
Holy
can
shit.
system it, that you don't have to follow it. Now, if you're trying to deviate from that.
Used to be a WWE wrestler back in the day.
Oh, I know him. I see
He
it.
plays in a lot of movies.
Oh, that's cute.
So with it
We'll
being in
put
your
that-
scope.
I like that photo. We
Let's
gotta
just
look
grab
at
that
that
photo.
photo.
Yeah,
Because
it's
his
fun.
last name's Husk. Yeah, and yes, for the little kids game from forever ago called the Overtones. You never heard that?
No.
I was just thinking his last name and like.
Yes, I think there was.
Little purple car.
Never seen
Okay, this was my favorite video game when I was a little girl. And it's just a whole purple car.
Hold on.
And you.
How long ago was this movie?
I sent you them, just in case he insults you, but I want to.
1997.
Holy shit.
How old are you, Harlan?
I'll be 41 next month.
Really?
Oh, quit your mission.
I'm not bitching at all. It's great. I made it to the age of 41.
July.
I'm.
Hey, I'm just happy I made it there, all right?
So that would be why.
He's an old part.
There's a few times where I was like, I don't think I'm gonna make it past 20.
So anytime you're going like out of.
That was, when I was in Iraq.
Nitro, you can live up to 3 doses.
Instead of making up now 41, I'm like,
With Epi, it's 3 doses. But again, that's like per the national registry standards, it's like out here. Like if we had a rating on protocols, we could do it.
hey, have you noticed that?
Sometimes you'll see it right now, like you give your initial dose and then call
For
medical
each capsule.
control. If I was ever put in a scenario like that, if I had to call medical control, I'd be calling medical control as like, hey, go to the first dose. Because by the time they get the second dose, I'm like, oh shit, they
Hey,
did it. I'm not
it's
gonna
so
have time
funny,
to
I
like
was
wait for a
all,
doctor.
the other day, I was all,
So that's usually how I would.
As far as dinner and tea testing.
After you're after.
Most of Willie, like all the over
Except for
40
night.
bucks. They have a lot more than that.
I'm sorry.
Makes sense.
I guess we're supposed to be.
Clear as butter. All right,
Lady.
we're gonna get through this.
No.
It is 39 slides.
Okay,
I believe in y'all.
let's go.
All right, so poisoning and, what is it? Overdose.
No rush.
No rush.
No, I have to go to work after this.
So do I.
Okay, so identify routes of poisoning. So what routes can we get poisoned? Specific signs and symptoms of different kinds of overdose, right? So we don't give everybody Narcan. What kind of overdose do we give Narcan for?
Opioids.
Very good. And
The
then we're
rest
gonna
of them just
review,
get a quick, swift kick in the ass.
I mean, if that's how you like to run your
Or shallow hole.
We're gonna Idaho.
Okay.
All right, so this can be kind of confusing because by definition, poison is any substance that can harm a body. So you can be poisoned by a lot of things, right? You can be poisoned by drinking too much water. That is something that can happen to you. So it can harm the body, but water itself, is it a poison?
No.
No. But the way that they word it here is any substance that can harm the body. So that's why it gets confusing. So you can have poisoning of something that would be seen benign. So common poisonings, medications, especially in kiddos and old folks, because kids love to put everything in their mouth, and then old folks like to accidentally take like 2 doses of their medication because they forgot that they took theirs. Petroleum products, so gasoline, kiddos, antifreeze, that kind of stuff. Cosmetics, so yeah, I guess you could be poisoned by some kind of cosmetic. Pesticides is a big one, so we'll talk about that. Plants,
Huh? The red and green ones, yeah.
plants and food. So, oh shoot, I can't remember. There's a very specific kind of plant, I can't remember the name of it right now, but kids like to take it. It grows in Georgia, I know, but
Like
it-
those milkweeds? Like
Huh?
those planting grass, like
That
the
was like
milkweeds,
mothers
little
in law
thorns on it?
maybe, but that's not the one. It has a weird name.
Honeysuckles.
I'll think of it. I'll think of it. Probably like in the middle of the night, I'll wake up from a deep sleep and be like, oh, it's this. And yeah, he's gonna be like, what are you talking about? I can't remember. Dang. But it can cause like hallucinations and stuff, and kids like to do it because it causes hallucinations. But it also can cause a lot of other problems, like heart problems. What is that weed that grows in Georgia that kids like to take that causes hallucinations? Why can't I think of it right? It's not driving me freaking nuts.
Mushroom?
I would.
That's a fungus, not a weed.
Yeah.
Oh my God, his face.
Excuse me, that's a fungus.
A weed that they like to take.
Yeah.
It causes hallucinations.
Yeah, if somebody says it, I'll be like, yeah, that's it, but.
Not Robert Plant.
No.
I've never done drugs, so.
What's usually wrong with you?
Snuggie?
I've never done drugs.
It might even be in.
You wear a Snuggie around, you can't tell me you've never done drugs.
All right, so effects of a poison causes harm to the body based on the nature of the poison. So like Benadryl can cause a lot of different signs and symptoms than overdosing on Tylenol, right? So different things can cause different problems. So it's based on its concentration. So how much did they take? This is a test. Don't make that. The route of entry, patient's age, weight, and health. So age is important because old folks don't metabolize as quickly as younger folks. So things can get kind of built up in the body. And it can take longer for it to take effect. Perfect example of this is like some antiarrhythmics, people will be taking them. They're not doing like the desired effect. And then because their metabolism is so slow, it'll just hit them all at once. So everything
Is it the Jimson weed?
That's it.
Okay.
Jimson weed, thank you. I was thinking Jay and I was like, James.
Jimson weed?
Yeah, we're in on that.
It grows in Georgia. It's a side of the road.
What about
They'd be like, what does that look like? We're going there here shortly.
I'm not gonna get to it.
Yeah.
Yeah.
Make your face
The bushes that grow around the station have little berries on them.
Right.
And I did an AI check of those berries, and it says that they can also cause hallucinations, but it's like hallucinations or death. So I'm like, dang it, can't eat those ones.
Moderation.
Yeah, right. It can also like cause arrhythmias and stuff. It's a family of the nightshade. So yeah. All right. So damage to skin and tissues. Certain chemicals get on skin and tissues. It can cause burns, rashes, all that fun stuff. So depending on how it's exposed, suffocation. So. Huh? What did you say? Oh. If you breathe in some kind of chemical like that chlorine gas video that we watched, that causes suffocation. It can cause inhalation burns, your airway swells shut. That can be a problem. And then localized, it can be just wherever it's affected, if it's on the skin. Systemic is everywhere. So it can affect one thing or many things, just depending on what kind of poison it is and how it's going to affect the body systems. So like Tylenol, kills your liver. It's very localized to your liver. Whereas if you take like an overdose of Benadryl, you're hitting your brain, you're hitting your heart, you're hitting your lungs, you're hitting your eyeballs. It's a lot of things. So routes. So inhalation, obviously, is breathing it in. Injection is some kind of ingestion. So rat poison, drain cleaners. Fun fact, there is a very popular anticoagulant medication called warfarin, and it was actually discovered because of rat poison. So it used to be rat poison, and the rats would eat it, and then they like bump on stuff as they were like traveling through walls and tunnels and bleed to death because it's a blood thinner. And they were like, you know what? This is great. Let's use it for humans. So rat poison, and then absorption. So household cleaners, insecticides. I've seen like drain cleaner, like Drano, cause some pretty serious looking burns. The problem with that is it's not like an acidic burn, it's an alkalytic burn, and that can cause, that's a burn that doesn't stop. Like acid gets to a certain point and stops. Alkalosis is like, just keeps going through tissues. So poison control is your best friend with anything like that, because not everybody's gonna know off the top of their head what, you know, this one chemical does. So you call poison control and they'll let you know. All right, kids love to put everything in their mouth. We already know this. They are explorers. I had a little 3-year-old drink a bunch of the pink Fabuloso a couple months ago. And I knew she did because the parents were like, here's my baby. And it was just like Fabuloso. That's all I could smell. So make sure that you have any cabinets locked. Make sure that medications are put up and away. If you're like one of those people that's dealing with meds for somebody that likes to put them in like their little Monday, Tuesday, Wednesday containers, if you drop a pill, make sure that it gets picked up. So my best friend's little tiny baby, she's just turned a year. She's turning a year next month. She found a carvedilol pill and put it in her mouth from her grandpa. So he dropped it, didn't know that he dropped it, or just didn't find it and was like, oh, it's fine. And then my friend found it in her kid's mouth. So make sure that that stuff's always accounted for.
Was she able to remove the pill?
She was, and she contacted poison control. And because like the words on it were still, because you know tablets are imprinted with numbers and stuff, because that was still visible on it, the poison control people were like, she didn't get enough to hurt her, so just monitor her. And sometimes that's the case. Like you'll call poison control and they're like, just monitor, they'll be okay. Other times they're like, here's everything you need to do. So public education is important. Don't let your kids be putting random stuff in their mouth, because they do that. That's how they're discovering the world. All right, so if you have a patient that was possibly poisoned, you're always going to figure out what substance was involved. You're going to get the exact spelling. There's a slide in here. It's like sometimes you might not be advised to transport the patient to the hospital. I will say in EMS or any kind of this work, just always expect to take the patient to the hospital. It's rare that someone's going to be like, yeah, don't transport that patient. That's never going to happen. So make sure you get the exact spelling. Figure out when it occurred. So this is important for like that stuff we never use, the activated charcoal, because if they swallowed a bunch of pills and it's been less than 30 minutes, that's your time frame for activated charcoal. So if it's longer than that, then there's too much of it absorbed. Usually they won't advise you to give it. Quick acting poison obviously is going to require a faster treatment. And then that's the cool thing about poison control too, is they tell you when to expect certain signs and symptoms. So they'll say like, if it's been more than a few hours, if they hit the right dose, they'll start seizing and they'll do this. So they kind of give you a timeline of what to expect, which is pretty cool. And then obviously you need to give this information to whoever you're giving your report to so they can file it too. Same thing with poison control. You call them, they get a case number, and then once we take them into the hospital will also call poison control. And you know, you tell them, hey, I already called poison control. They'll get the case number, or they write down all the patient's info. So then the hospital also gets the same information. A lot of times poison control will just call the hospital for you and they'll give a report as well. So they're like, hey, you got this coming in. This is what you can expect. So it's kind of cool. Poison control, pretty dope. I like them. So other interventions that have been taken. So home remedies. You'll see like a lot of the older folks, they love to get served with Epicac for whatever reason. We don't do that anymore. Sometimes they'll be like, yeah, I drank milk. It's supposed to help. So make sure that you're writing down whatever home remedies they have. And then sometimes these labels have their treatments and what are indicated for treatments. So at the mines, do you guys carry those big books that have all the chemicals?
All those,
Yeah.
now.
Oh, is it? So if you can get that too, like if you're on a mine site or some kind of industrial facility and they were in contact with some kind of chemical there, you can usually get that information. Usually the treatment is in that stuff too, so. The one and only time I've ever had to see one of those things was like they were washing like a bunch of, I think it was the hospital. I don't think it was a hospital. What was it? It was at some facility, but they were washing something like in giant washing machines, and the soap got in the girl's eyes. And so they pulled out one of them big books and was like, "Here's what we got." It was before I knew what that thing was. So the patient's estimated weight. So children experience greater effects because of the smaller size. The other thing about children though is they metabolize a lot quicker than adults. So a lot of times if they're exposed to something, it can affect them a lot quicker. So it's important to get their weight. Patient assessment. So take note of their signs and symptoms. So if it's like they drink something, you want to look in the back of their throat, look around their mouth. What kind of smells are coming off of the patient? So you can smell like a very chemical smell. If you're a baby that just got tossed at you, it smells like Fabuloso. Are they vomiting? If they are vomiting, how many times have they vomited? So the problem with vomiting something up is like if they swallowed it and now they vomited it, and it's like something that's very caustic, that's 2 times the burn. It goes down and then it burns coming back up. So it can cause a lot of other issues. So make sure you're taking note of all that. Yeah. If there is like a kid that's acting funny, I've gotten that call before. Always search the medicine cabinets, ask parents what kind of pills they're on. Teenagers like to take parents' pills or grandma's pills and try to overdose on them. That's a very common thing. So try and get how much is in that bottle and how much is missing. How much would you expect that bottle to have? So if it's a 30-day supply and they just got it refilled yesterday and now there's 2 pills in the bottle, like they took 28 days worth, right? So you can do that kind of math in your head. Usually I can't do that math in my head. Yeah. Oh, there was a calculator, like 190 days minus. Also, not just prescriptions. So like I've had a patient that their neighbors called because they couldn't get him to answer the door. And we got there, ended up getting into his house, and he was like hallucinating. And I was just like looking around on the counters like, what is going on with this guy? Like, why did he take drugs? Like, you know, you're doing your scene assessment. And he had a CVS bag with a bottle of Benadryl in there. The receipt from today, like that day, of the Benadryl, and it was empty. And so, like, that's how they'll be like, oh, this is Benadryl overdose. That makes sense. He's seeing the Hat Man. But so not always is it just the prescriptions. So even around here, we had a lady that took Tylenol. We went out on her. The Tylenol bottle was a certain amount filled. Another crew went on her like a few days later because she said she was trying to kill herself again. I don't know why they released her. She was trying to kill herself again, and that whole bottle was empty. So, like, take note of that if you're going on the same patient multiple times. Those things you kind of want to, like, mental note. All right. For children, younger children, it's usually accidental. Teenagers like to do the whole, I'm going to take the whole Costco-sized bottle of Tylenol thing. So usually that's not accidental. Adults, often not accidental, or it could be deliberate. So if they're attempting to take their life, they will do that. Here's that under the sink, all the little poisons. Yeah, kids are curious.
There's a skull and crossbones.
Yeah, they definitely set this up like perfectly. So, yeah, kids like to, they're like, what's this funny thing? Usually kids, if something tastes really bad, they don't get like a lot ingested. Like I'm pretty sure the kiddo that I took didn't ingest a lot of Fabuloso because she was like spitting it out, like she didn't like the taste of it. But antifreeze is the exception, right? So antifreeze is very sweet. So a kiddo gets a hold of some antifreeze, or like a dog gets a hold of some antifreeze, and it's very sweet, so they're not gonna spit it out.
A lot of poisonous substances, they have this chemical that is disgusting, they put on batteries now.
Yeah, they'll coat like certain medications in it and stuff. I've heard that about the batteries before. Button batteries, those should terrify everybody in the room. If I go on a kid that is possible ingested button battery,
Stopping at the Dollar
we're
General.
stopping at the Dollar General and getting some honey. So honey will coat it so that button battery will actually burn through tissue. So whenever they ingest it, where it usually likes to hang out as it starts to go down their esophagus, just happens to live right next to their aorta in their heart. So if it burns all the way through, it can get to the aorta. The theory behind the honey, and it works because I did a like presentation on this in paramedic school. If you take a button battery and put it between two pieces of ham, it'll start to burn the ham. But if you coat it in honey, it stops the burning process. So they recommend, if you have a child that's ingested a button battery, if they're old enough to have honey, obviously if they're younger than 1, they're not allowed to have honey because botulism, then you give them tablespoons of honey on the way to the hospital to coat that so they can go in there and get it out.
By button batteries, do you mean those small little like watch ones?
Yeah, yeah, like little tiny flat guys that look like a coin.
Yeah.
All right, what is this?
Charcoal.
Like almost as you say,
Yuck.
But
it absorbs.
It adsorbs. Very good. What does that mean?
it adheres to the outside, or, yeah.
Yep.
Holds on to it.
Surface
I can't
area.
word,
Coat.
I like
I
it.
remember it.
It coats the outside of whatever pill they took, and then it will stop it from absorbing into their intestines. What's your dose?
Whole tooth.
The whole tube. Yeah. So I believe it's weight based, 1 gram per kilogram. Usually for adults, it's the whole tube. It's a max of what, like 15? Yeah, that's great. So, max of 15.
I think I did this, and it's anything over 100 pounds is the whole thing.
Okay, yeah, cool, good to know. So most adults. And most kids really now, these days too. So not an antidote, so it's not gonna stop that poison from working in the body. It's not gonna reverse it, if that makes more sense. So it binds to poisoning by mouth. So altered mental status, if they cannot swallow this, do not give it to them. If they haven't ingested of any kind of acid, alkali, or petroleum products, if they swallow like a bunch of fluid, it's not gonna work. It needs to be like a pill, so it can cover the pill. If they're vomiting, wow, who taught me how to spell? They are inability to swallow. So active vomiting, it's gonna make them vomit usually anyway, and then if they can't swallow, obviously. So 1 gram per kilogram body weight, usual is 25 to 50, 12.5 to 25 is usual for your pediatric dose. The trick here, if you have a styrofoam cup or a cup that you can't see into, you're supposed to put it in there and then have them drink it like through a straw. I have never worked on an ambulance that carries cups. So I've only ever worked on one ambulance that actually carries activated charcoal.
Yeah, it's trash.
Look at her. She does not look happy to me. She said, yuck. So anytime you expect vomiting, yeah, please hold it. Anytime you expect vomiting, you should always have your suction ready. At the beginning, I don't know who all in here rode with me yet. You rode with me. You were here for a little bit. You rode with me. I like to pre-set up my suction, so all I have to do is grab that thing and turn it on. Because if you're sitting there trying to open packages and connect and figure out which one goes where, they're like, just have it ready to go. All right, so acetaminophen poisoning.
This is the 14-year-old's favorite way.
Yep. I took all of the Tylenol. I want to die. And you're like, I'm not dying today, but a year from now, you're gonna feel a lot of things. Bless you. So very common. It takes a lot of Tylenol to actually cause any damage. The max dose for adults is like a gram, or like 1,600. What is it? It's a lot. It takes a crap ton of Tylenol to do any kind of damage, especially for an adult.
At one time, or
Yeah.
Yeah, in a 24-hour period is what I'd say. So usually, if they did take a toxic amount of Tylenol, 4 to 12 hours, loss of appetite, nausea, vomiting, because it is an NSAID, it irritates the lining of the stomach. So even somebody that takes Tylenol like a lot for a long time, they're usually susceptible to like stomach ulcers. So Tylenol, it disrupts the lining of your stomach. So that's where you get this. And then your right upper quadrant pain, why is it the right upper quadrant? Liver. So Tylenol is metabolized through the liver. And so if you have a toxicity of it, their liver is damaged. So right upper quadrant pain, jaundice, you might have like tenderness, and like you might be able to feel the liver. The antidote is called acetylcysteine, and that is something that the ER gives. We don't give that. So if they'll check Tylenol levels, and then if they meet their criteria, they will hang acetylcysteine and they'll transport. Acetylcysteine. This is very uncommon. Occasionally you might hear like have the patient drink water or milk to dilute whatever they took. Water might slow the absorption, but milk might soothe the stomach. Really, unless you're advised to do this by like some kind of poison control, don't just go giving people milk. Because the other thing is if they have to go in and have any kind of surgery to get this stuff out or anything happens, they don't want them eating or drinking anyway. And then just remember, whatever you give them, they might puke up later. So what do you want to clean up? And I don't like cleaning up milky puke. It's disgusting. So again, unless poison control advises you to do this, I wouldn't do it. Or if it's in some kind of written protocol somewhere, I just wouldn't. All right, food poisoning. Who in here has had it? I got it from freaking rice.
Chicken.
It was rice. It was disgusting. I was sick for 24 hours and then I felt great. So, food that's not prepared properly, obviously. So nausea, vomiting, abdominal cramps. Every time that I've had food poisoning, I can feel it like moving. It starts up here and I can feel it like pain. So usually diarrhea can cause fever. It doesn't show up right away. It's not like I take a bite of my rice and then start puking immediately. It's something that can present all the way up to 48 hours later. Usually it's about 24 hours. So you just gotta get it all out. Your best treatment for this is getting it all out of your system. So your little tummy's not happy.
What kind of food poisoning is it when you eat pasta that's been out all night? It's like super bad.
I know honey is like the botulism thing. I don't know if pasta is the same thing.
Honey, can give you botulism?
That's why, yeah, you can give infants botulism.
Oh, okay.
What is botulism?
You're basically shitting yourself to death. You can get it from like improperly canned food as well.
what about the metal inside of the can before first food?
Bacillus cereus. I don't know.
Like, I know if it's like exposed to air, that's what causes like the.
Actually, I was always told that you leave a spoon or a fork, like SpaghettiOs can, and leave it in the fridge. That's not good.
I've also heard that, but I don't know why.
I don't know.
That'd be good.
That was like, my mom and dad always said that, don't do that shit.
Yeah.
What?
Is it a fork in a can of SpaghettiOs?
You know, I was also
Anything with
taught
it
that
like
when I was a child.
Like soup can or anything.
I've had so many cans explode in my face because of botulism, and it smells like rancid vomit,
Yeah, I've heard that it has a very distinctive smell.
like a car accident. You won't
Just
forget
chew it
it.
back in it.
Okay, so inhaled poisons. I need to make a list of things to Google.
Again.
Pork in can.
And
In the fridge specifically though, right?
yeah,
I remember learning this too.
There's also the rice.
it's rice, not
It's
pasta.
mostly for bacteria.
I'm telling you, rice makes you sick. That's what got me sick.
After 4 hours, rice and pasta gets some bacteria that builds up. That's really, really bad.
Like after cooking it?
And that reheating does not kill.
I
I mean,
I've been trying to tell this guy I got food poisoning once from a food truck in Atlanta. I was like, it was the rice, and he's like, no, it was the chicken. It had to have been a chicken. I'm pretty sure it was the rice.
And it's only if you leave it out. Leave it out on like a counter.
You have to leave it out like room temperature for 4 hours.
Oh, well, I used to smash that freaking Japanese steakhouse.
Yeah, but the reason we argue about it is because I got sick and he didn't, but we ordered the same thing except for he didn't get rice. But he
So it's
remembers
rice.
it differently.
I
I
didn't
don't
get
know.
chicken.
Anyway.
It's domestic dispute.
Alright. Ding ding.
I lose
He's
that.
like, no. Alright, inhaled poison, so very common, carbon monoxide, they do this into their car. Remember carbon monoxide poisoning, what's your treatment for it?
A lot
A lot of oxygen, yep. And what can it mimic?
High oxygen on the full
Yes, good, yeah. So carbon monoxide has a higher affinity to your red blood cells than oxygen. So your red blood cells are like, yeah, give me all the monoxide. Then it gets on there, but our pulse ox reads it as oxygen. So it'll still say 100%, but your patient's sick as crap. So we have CO monitors on our trucks. They're working that day. So you want it to be less than 7, but you should get concerned if it's higher than 25. So it'll pop up on low numbers there. It says SPCO, and then if it's higher than 7, say it's like 8. Usually they've been smoking. If it's like a chronic smoker, it'll be a little bit higher. Or if they were like near any kind of fire, it will go up a little bit. Chlorine gas, ammonia, mixing ammonia, was it ammonia and bleach? You can cause a lot of problems there. Agricultural chemicals and pesticides, that's a big one. If you inhale it, also if it gets on you, so just be careful.
I have a public service announcement. The hydrochloric acid we use at mines typically is oftentimes stored with bleach, but that will create mustard gas if combined. So just a fun
No, that's
fact.
some chemical warfare going on.
I did
there.
that.
Well, we use cyanide too, you know.
I did know that. I did know
That's a
that.
chemical warfare.
And if you
Yeah,
just
we're
slowly collect.
Very aware. We got paid out to a freaking wreck on 305 that involved a cyanide truck.
Oh, shit.
Collect 300 apple seeds. Yeah,
Anything transwood.
the apples are free.
Anything that's transwood, cyanide.
One more one, and you make-
Yeah, I don't know who the truck was, but it was all cyanide.
Yeah. And even more fun fact, like the amount of cyanide that y'all are exposed to at the mines, that if you get like a decent exposure, even with our antidote that we carry,
Cooked.
But geologists are dum-dums and they put
They were off
hydrochloric acid everywhere. So they'll like lick their hands and then touch the rock with all the acid on it and then lick it and shit. We're disgusting.
they're like, this tastes really good.
Yeah, for real.
That's why you guys don't get sick.
Burn it all.
Yeah. All right, inhaled poison. So if it's a hazmat situation and you're not trained to be a hazmat person and you're not part of that team, do the thumb rule. So if you can see smoke, if you can cover the scene with your thumb, you're a perfect distance away. If you're clear to go in, you're gonna obviously use additional resources, but a lot of times it's a lot of like disinfecting the patient, or what do they call it? Decontaminating, thank you. Disinfect them. Spray them with Clorox. You're gonna decontaminate. That is done on scene. You're not gonna decontaminate them in the back of your ambulance. They're gonna get decontaminated on scene for however long, usually it's like 15, 20 minutes. And then they're gonna get decontaminated again once they get to the hospital. They have a whole nother room for that, so. What substance was involved? When did the exposure occur? And then any interventions anyone else has done. So ventilation of the area. Do you guys carry like those pop-up shower things? Is that what they're-
And
Yeah, we have the shower.
the trailer?
Yeah.
The whole line that we built, I don't think we're gonna put that up.
Pop-up showers.
We got a whole trailer for hazmat.
Yeah, I mean, you're exposed, you're gonna be burning. That's what I
It's
thought, but I
great.
thought we still have like the shower bit.
It's like the scene from Monsters Inc. with the sock on the back.
2319.
Yeah, 2019, we got 2019.
And our suits were the same exact color.
Are they? Yes. All right, so carbon monoxide, colorless, odorless, tasteless. This, like if we're dealing with like RV campers and stuff, if they have a CO leak, that gas is heavier than or air, so it'll hang out like near the floor. Usually those monitors are by the floor on lower sides. Furnaces, generators, if you ever are dealing with like, you walk into the house and you can smell like that generator smell, you should be suspicious of this. Especially the textbook question is going to be, you have a whole family that started experiencing a headache. It's always multiple people, but obviously if they live alone, it's not going to be. So your signs, usually they get like this headband headache. It's a headache that feels like they have a really tight headband around their head. They can have like dizziness, coughing, chest pain, all of that stuff. Your big ones are that headband headache, and then they get like cherry red lips as well. So those are going to be like your little, this is carbon monoxide, if you ever see it on a test question. So there's all your signs and symptoms.
Cherry red lips, but they'd also be cyanotic.
They can be cyanotic, yeah, but I'd say either or, because like that cherry red lips happens, but if they don't have enough oxygen, they're going to be blue. We don't carry these on our ambulances here.
Oh, they have them on a fire truck.
Yeah, they have them on a fire truck. Usually fire is out there with you for this kind of call. And that thing will yell at you. The fire truck.
Big old 5 foot. Okay.
Yeah, yeah. I don't know my birthday.
Lots of oxygen.
Yep, just give them all the oxygen you can. So again, that pulse ox might read 100%, but that is false. So administer oxygen, treat your patient. It takes time to wash it out. CPAP is great for this too. If they have a really high CO reading, putting them on CPAP is awesome because you're just blowing everything out of their system. There is a chance that if they get to where they're unresponsive, you're going to have to bag these patients because you're trying to just get as much oxygen saturated as you can. They need a hyperbaric chamber. I don't think we have one anywhere close to here. Maybe Reno.
Yeah.
Salt Lake
I
Valley has
caught
one.
one saying one, but there was
There's-
one in Elko, but
there's
we
one in-
possibly can't use it.
Yeah, there's one in Elko, but it's not an emergent. It's like a procedural hyperbaric.
Oh, okay.
So I think they can gain access to it. It's kind of a pain, but
Huh?
You start
Yeah, just call everybody and be like, excuse me. All right, so smoke inhalation, this is a big one. This is something that's not always going to be super obvious. So if you're dealing with like somebody that walked out of a house fire, this is where your assessment skills come into play because not everybody's face is going to look like this. Sometimes it's just like barely around there, or you'll see singed nose hairs. They open their mouth and it looks like they have soot on their tongue, and then they like are talking with a really hoarse voice. That person needs an ALS airway immediately. So even if they're walkie-talkie breathy right now, they need it right this second. So that's where you get ALS hopefully already coming to you. But the singed hairs, and then usually if you're dealing with burns as well, there's a lot of things going on all at the same time. So smoke inhalation, if you have access to a nebulizer and you can nebulize normal saline, that's really big if you're trying to bridge to like an advanced airway, like if you're waiting for ALS to get there, or say like you can't do RSI wherever you're working, where they can intubate them. If you nebulize saline, that'll help with the swelling to buy you some time until they get that airway in place. So if you have access to that, that's really big. Also, CO poisoning and house fires, they go hand in hand too. So it's really important to monitor your patients for that kind of stuff as well. If you have a CO monitor. Move patient to a safe area. Don't let them hang out in the burning house anymore or close to it. Early consideration of ALS for airway, high concentration oxygen, assess the patient, transport. Here's just another picture of more things that you might see. So swollen neck, usually that swelling's on the inside, but sometimes you can see it on the outside. If they got burned on their neck and everything's starting to swell, burns are scary because there's a big fluid shift that happens. So our body's like trying to send all of its resources to that burn, and it'll start to leak fluids and swell up around that area. So any kind of swelling of the neck should be considered an impending airway failure until proven otherwise.
So is that due to like vasodilation?
All of it.
All of it?
Yeah.
So it'd be a good idea to give like an adrenaline, some sort of vasoconstrictor.
No, so the problem with that is once you speed up the heart rate, it's been sending more resources. It's like faster, like it's dumping more, right? So you want to try and keep these patients calm, but if you give them adrenaline, they're going to get that sympathetic. Yeah, so sometimes you'll see that they can inhale, like you can inhale epi, but it's usually not used for like burn treatments. That can be used for like kiddos having a lot of breathing problems. It's really proven not to help that much in adults, but I do like the thinking behind it because you do want to kind of stop that, but epi's not going to help these folks because burns, there's a lot of like bradykinin releases. There's a lot of our, not only immune system, but like our clotting factors all get sent there because our body's like, we're hurt, send all of everything.
Right, so if you were clotting and you had a vasoconstrictor, then it's just a bad day.
Yeah, because there's more like patho behind it than just vasodilation. There's like little enzymes and proteins, yeah. I mean, you're still getting the edema with it, but there's a lot more that goes behind it. So with the swelling and everything. Yeah, epi, it would maybe help, but if you're increasing their heart rate, it's just sending more stuff that way. So you're trying to keep them calm, and epi's not going to keep them calm. I do like the thinking behind it though, but it might help with like one of the 20 things that's going on.
That trauma. We get a chapter research about burns.
I can't recall the chapter off the top of my head. And I don't know if there's a whole chapter dedicated to burns.
It's not.
Yeah, I don't know if there's a whole chapter dedicated just to burns. It might be. I don't know. I'd have to look. It might just be a snippet in another chapter. Look. All right, detergent suicides. So started in Japan, becoming more common. They mix chemicals in this closed compartment, usually a vehicle, and then it gets released, and then you go down. So if you deal with something like this, be mindful. Once you open that door, now you're exposed to that same thing. So fire department, great resource for something like this. Fire department's a great resource for somebody trying to, gas themselves out in a garage as well, because they can go in there with their little fancy masks and get them out. All right, adsorbed. So absorbed with a B. I don't know why when I looked at it right here, it looked like a D. Dyslexics are people who. So absorbed poisons can be absorbed through skin. The big thing about this slide is like if they do have a powder on them, don't wash it off with water. Yeah, brush it off and then start irrigating, because a lot of times if the powder comes in contact with water, it like activates it. So if you can get the name of whatever they've got on them, try and write it down and let folks know what time is it? Dang, God. Okay. All right. Injected, so this is technically an injected poison, so venom of snakes and insects, or illicit drugs injected with a needle. Who here has heard of the lady, or I think it was a dude, somebody, crushed up a black widow and injected it into their veins? Yeah.
Why would you do that?
Yeah, I don't know.
Because Spider-Man.
Yeah.
Spider-Man.
Yeah. They did not kill Spider-Man. I'm pretty sure they perished.
Super damn.
Yeah.
So with us being out here in Nevada, do we carry anti-venom on our?
Nope, we do not have anti-venom, and actually this hospital doesn't have it. So the anti-venom for rattlesnake bites is about $10,000 a vial.
They're only
So-
good for a couple weeks, aren't they?
Huh?
They're only good for a couple weeks.
Yeah, they're not good for a very long time, and so right now Winnemucca has it, Elko has it, and so if we call for like a flight, there's a chance that like the flight would stop on the way to Reno at another hospital to get it if it was needed, but it's very, very expensive.
And they really don't give it unless there's signs of impending cardiovascular collapse. So they could be having a lot of symptoms, and because it costs so much and because it takes so much of it to work, they're like, well, we're going to try doing as much as we can. Very expensive. We're going to try doing what we can before we actually even give it.
So at that point, it would be treating the patient and just, or the symptoms. and just
Yeah.
making sure that we're
Wasn't
doing
there
what we can.
a patient last summer? A young
Little girl.
girl? Yeah.
It was a few years ago.
Oh, the one in
That was in Winnemucca.
that died. Yeah.
That was in Winnemucca.
Yeah, the whole story behind that's kind of interesting because they tried blaming the hospital, but the parents didn't bring her in until like hours later. So she was already like having a lot of really, really bad symptoms. So, I did hear about that, and I remember they were trying to blame the hospital or sue the hospital or something.
Yeah,
I
they're
heard
trying
that
to
the
sue the hospital.
hospital didn't give the antivenom, but they had it.
I don't know, I'm not getting down that weed.
Yeah.
Because I wasn't
That's a
there.
whole different
Yeah.
Oh, that's what it was.
Because the guy in our, the EMR teacher, he was
Yeah.
telling us the story that they made the decision to drive from Reno and
Yeah.
ambulance or something like that.
Just set a
And
flyer.
She ended up dying.
She died on the way
Yeah.
in the parents' car to Reno.
I thought it
No,
was
she was in the
like-
ambulance.
So it was their own personal
No,
car.
she was in the ambulance.
Oh, was she?
I don't remember. I remember someone told me at one point, but
So, poison, help,
yeah, poison control. Here's the number.
1-800.
222
Help.
1222. Yeah. So when you call them, they'll direct you through what information they need. So. All right, alcohol abuse. So this one is alcohol. Not only drunk people can be really annoying, but alcoholics. Like, look at this brain. It literally pickles your brain once you like drink for a long time. Not only does it pickle your brain, it kills your liver, and cause a lot of other issues. So, ruin your kidneys, make you lose your vision, all this fun stuff. So, alcoholism, no fun. Makes you basically
Bad
die.
for you.
Yeah. So, abuse of alcohol crosses geographic and economic. So people use alcohol to bury their feelings, and then they get reliant on it. So, whatever the two things that can kill you when you withdraw from them? Alcohol and benzos. So, whenever somebody is an alcoholic and they're trying to stop, it's not one of those things that you can just quit cold turkey. Once your body's that reliant on it, it can cause seizures, delirium tremens, the DTs. So it can cause a lot of issues. You walk in and a patient you're suspecting alcohol withdrawal, and they're like trying to grab flies that aren't there. They're getting ready to seize on you. I've learned. So hallucinations. So alcohol abuse, there's a whole range, right? So you can have somebody that's just drunk and the friends are like, I don't know what to do with them. And you get there and they're all like loopy and, or they could be completely unconscious. They can be somebody that's, alcohol, like withdrawal can cause like alcohol calls, and then like your chronic alcoholics where they're having the liver failure, their brain is pickled, they now have like really bad dementia and all this other stuff. So it affects the central nervous system. It's a downer, so your reflexes slow way down. We've all been through the classes in high school where they're like, "Don't drink and drive, this is why." Irrational or aggressive. Everybody in here has dealt with a drunk person in their life at some point. And then if you consume with other drugs, they can potentiate each other. So, especially like benzos, if you take benzos and alcohol together, it causes the half-life of a benzo to be like 2 times more than it would be if you just took the benzos. So alcohol interacts with a lot of medications. All right, so many medical conditions may mimic alcohol intoxication. One that comes to my head immediately is like DKA. So that fruity smell that they get on their breath, for some people that smells like alcohol. So they smell it and they're like, oh, they're drunk, that's why they're acting funny. But it's actually a diabetic problem. So high sugars and low sugars. If someone's like unresponsive and they're like, yep, they're just drunk, again, that might be just an alcohol thing, or it could be a sugar thing. So sugar is a big one that comes to my mind. Remember, your intoxicated patients might also have medical or trauma problems. So if somebody is drunk and they get hurt really bad and they don't look that bad, they can have a lot more going on inside just because they are sedated. Basically, everything is, all their nerve endings are no longer sending out their little signals. So we might, you guys should know the signs and symptoms of intoxication, I would hope. Strokes can mimic alcohol use. So withdrawal from alcohol, the delirium tremens, usually the patient will tell you, like, I've been in DTs before, is what they call it, is DTs. If they seize, hallucinations, tremors, they usually feel like they have the flu. So we have someone around here that likes to call when she's going through withdrawals, and at first glance you'd be like, yeah, it looks like she just got the flu. Then you learn her history and know that she drinks a shit ton and she hasn't drank anything for a day. So if you have somebody that is an alcoholic, it's important to ask when their last drink was, what is their normal, how much do they drink a day. That's also important, like if you're expecting them to be admitted to the hospital for a long time, sometimes you'll see like a prescription of beer. Like that'll be a prescription on somebody's stuff if they're staying in like long-term care. A glass of wine, that could be a prescription for somebody. All right, so chemical substance that is taken for anything other than therapeutic reasons. So opioids, opiates. So opioids and opiates, the difference is where they're derived from. So if it's like a plant derivative, it is an opioid, and an opiate is like a lab grown. So that's the difference there. Use to relieve pain, cause a state of relaxation. Codeine, Oxycontin, Percocet, heroin's a big one. So these are all downers as well. What happens whenever you overdose on an opiate? You stop breathing. What happens to your eyeballs? Meiosis, they constrict. So relax muscles, reduce rate of pulse rate and depth of breathing. Usually they become hypoxic. It turns into bradycardia. It'll be tachycardia, and then as they progress with the hypoxia, they'll become bradycardic. That's usually like peri-arrest. They're getting ready to die if they're bradycardic. Meiosis is that pinpoint pupils, relaxed muscles. They'll be diaphoretic. They'll look pale, sleepy, and sometimes in a coma. So if they're just unresponsive, there's your opiates. Teeny tiny. Muy poquito. This is also something to look for, is track marks. So you might see this. Sometimes they inject it in between their little finger or their toes as well. But this all gets very sclerosed, so it can be difficult to get an IV on somebody that has this kind of track marks. Because of that, it's all just scar tissue. All right, it's Narcan, not Narcan. What's your dose? 0.4 to 4.
4.
And
Says right on
can you give it multiple times?
Yes.
Yeah.
And oxygenate first, thank you. What's your contraindications? If the patient is breathing, I think is what y'all's thing says. So indications, suspected opioid overdose. If their patient is breathing on their own. So we don't give Narcan unless they're not breathing. I used to be in the mindset, like, I'm uncomfy, I'm gonna give it to them. But we don't give it unless they're not breathing at all. So 0.4 to 2 and 0.4 to 4, I think in your guys' paper. You can go all the way up to 8. Just don't be given like 16. Like if you give 16 and they haven't woke up at all, like stop trying the Narcan, try something else. There's something else going on with them. So 2 to 4, these little preloads are 4 milligrams. You can't titrate. Usually it's like half and half in each nostril. These guys, once you push that button, it's all going in. So whenever you're giving it to somebody, you're going to put it in their nose and you're going to angle it towards the top of their opposite ear. So you want it to cover all of their mucous membranes. So that's how it's getting absorbed. Again, it doesn't matter if they're breathing or not. This is still going to absorb. Some people think that this isn't going to work if they're not breathing. It will, because it's just soaking into everything.
So if you gave a second dose of that, you'd give it on the other side.
Yeah. And usually if you're going up the nose, it's gonna like you need more for it to work. Makes sense. All right, fentanyl. This one is our pet peeve. You're not gonna overdose by touching a dollar bill with a speck of fentanyl on it. Please get that out of your heads now. That is a big like fear mongering thing. They're like, this much fentanyl can kill you. So it would take hours of you being in a room that has aerosolized fentanyl in a powder form for you to overdose. So you're not going to overdose by it touching your skin. You need to ingest it in some way, shape, or form. So please, every
No matter
video.
how many freaking sheriff department or police videos you see them falling out on the side of the goddamn road, freaking hyperventilating. That's not a thing.
Because it's hyperventilation a sign of an opioid overdose?
No.
No, it's the opposite. It's the opposite.
Exactly.
So they're laying on their back and they're sweaty and they're like.
That is called a panic attack. That is not an opioid overdose.
Yeah.
Narcan. Pocket fentanyl.
If it was the case that you could touch fentanyl and overdose from it, drug dealers would be really easy to identify because they'd be walking around in hazmat suits. So that's all I gotta say. All right, uppers. So stimulants. So cocaine, methamphetamine. This can cause that excited delirium. They call it drug-induced psychosis now. Excited delirium is offensive to somebody somewhere. So can be snorted, smoked, or injected. Your signs and symptoms is everything of the sympathetic nervous system. So if they're excited, they're restless, they breathe fast, they have a dry mouth, they talk like dilated pupils, so sympathetic, right? So sympathetic nervous system, our pupils dilate. And then if they don't sleep for a long time, so meth, they get on their little 3-day benders. Same thing with cocaine. Never done either of them. I was accused of dropping some in a police vehicle once. I've been proven not guilty since. So.
Yeah.
All right, downers. So this is anything that can depress your central nervous system. So benzos is a big one. So seizure medications. Benzos can be used for anxiety, for sleep. Roofies, another one. This one is called gamma hydroxybutyrate. In Georgia, they called it Georgia Homeboys. So what it does is like they're starting to overdose, they get all excited, they dance. It's used in clubs to like drug people, but they get like hyper excited and they start like dancing around, moving around, bouncing off the walls, and then all of a sudden they just fall and stop breathing. And so you have to bag them through their little apnea period, and then they'll slowly come back out of it. So this is a big one. It's like a date rape drug is GHB. And then, so sluggishness, poor coordination, decreased pulse and respirations. For roofies, same kind of thing, and benzos. Bad day. Hallucinogens. Ew. All right, so excitement and distorted perception. So they could have vivid hallucinations. PCP is a crazy one. If someone takes too much PCP, they can freaking pick up cars. I swear, like they get crazy. Usually they're running down the road naked because they feel like they're overheating, and then they're just being crazy.
There was a question on the pretest on this one that it was talking about angel dust. I was like, what is angel dust?
I think it's LSD. isn't
Yeah.
it? Yeah.
Yeah.
I'm not good at the drug lingo.
Yeah, it was talking about the patient being on angel dust or something. I was like,
What is that? Yeah, I think I'd have to Google it too to be sure. Angel dust. Lucy in the sky with diamonds. Big thing with these patients, keep them calm. If they're in that state of PCP where they're ripping through buildings and picking up cars, they need to be sedated. So the thing about any kind of like excited delirium, those patients will die on you so quick. So if you have a patient that has everything super elevated because they're on an upper, like cocaine or methamphetamine, so their blood pressure is going to be high, their heart rate's going to be high, their temperature is going to be high, their respiratory rate's going to be high, everything's just high. They'll stay like that, their body's running a marathon internally, and then, they get into it with the police or with us, they get restrained, and then they die, and then everybody comes back and is like, the police killed them, or paramedics killed them. No, it was probably excited delirium that killed them. That's why it's really important that you're monitoring your patients and assessing them. So. All right, whippets. So volatile and tough. Whippets are the big one. Spray cans into a bag and inhaling. It can cause like burns around their mouth if it's a spray can because it's cold, like cold air that comes out. Usually it's like that keyboard cleaner stuff that they use. They go unconscious for like 10 minutes and then they wake up fighting you and then they're good to go. That's usually how these kinds of things go. So they can be days, loss of contact with reality, swollen membranes in the mouth because of those burns. And then because they've been hypoxic and because of the chemicals that are in like whippets and stuff, you can have changes in heart rate as well. It can cause some heart issues. All right, so polypharmacy overdose. I'm keeping it so late. Polypharm overdose is just multiple medications mixed in there. So they took like a handful of 10 different kinds of meds and they're having a slew of symptoms. That's something that you need to consider. You should be mindful if you know for sure that it's a polypharmacy overdose and you go to give Narcan. If you reverse the opioids, the other ones kind of take over. So sometimes if you call like medical control or whatever, poison control, they'll advise you not to give Narcan if it is a polypharmacy overdose. Because sometimes that opioid is kind of keeping everything leveled out. And as soon as you get rid of that, the other drugs can take effect a lot. So, all right, signs and symptoms of a drug withdrawal. So shaking, they feel like they have the flu, can have hallucinations. Again, benzos are the only ones that are really going to kill you, but they're going to feel like they're dying if they're withdrawing from other stuff. Be mindful of that.
What is heroin?
Depressant, yeah. It's an opioid. An opiate. It's an opiate.
Heroin is from a plant.
Yeah, you have to do a lot of lab shit.
A lot of lab shit. I know because I played Schedule 1. They don't have heroin on Schedule 1 though.
Gasoline and shit.
Yeah.
Sitting in a little box with weed whacker.
Yeah.
That might be it.
All right. What questions do y'all have?
Saying like the job offers, you're like,
I get paid $100,000 to fly this airplane every 6 months.
this has to do crash landing? Yeah.
Yeah.
Okay, very good. So 24, 25. Is that right?
Yeah.
You're
So,
testing on 24 and 25 on Thursday.
write it down. You.
All I got you.
So like I said, Uber will be here on Thursday. I've already let him know.